Welcome to the clinical Cantonese lesson provided by Family Care Physiotherapy Clinic 臨床講苦話. Today we'll go through the topic dementia. This lesson continues on a clinical topic, but I have to give a disclaimer because this video is to mainly teach you clinical Cantonese. Some descriptions are used in this lesson are for more severe condition only, and not for general condition of dementia, so don't be too much alarming. Some of the advice may not be very specific under my scope of practice as a physiotherapy. So in real situation, if clinical case, please consult an occupational therapy, clinical psychologist, and geriatric doctors in real situation. As we all know, dementia is the cognitive decline due to brain generation, so it's considered as geriatric disease. So how to say in Cantonese? In a more official term, we call it 失智症. 失智症. In a less official term, because less specific, then we just call it degeneration of the brain. We call it 腦退化. I want to introduce one more historical term because nowadays we consider this offensive, but we don't say it anymore nowadays. But it's good to know because some very old uncle aunties, if they really don't understand, if you say this term, they understand what it is. We call it 老人痴呆症. 老人痴呆症. Of course, it's offensive, but sometimes if you need them to understand what you're talking about, yeah, you may need to say it. Before I say about the symptoms, I need to highlight that it is a different condition with Parkinson's disease. Parkinson's disease is more in motors, about affecting the motion, but they're cognitively normal. Dementia is more on the cognitive, but their motor can be normal. So the first major symptom is about the being forgetful. Officially, we say it forgetful as 記憶力衰退. 記憶力衰退. But this is more medical jargon. If you need the layman to understand, we say in Cantonese as 冇記性. 冇記性. To be more precise, they are only poor in short-term memory, but their long-term memory can be quite intact. So long-term memory, we say in Cantonese 好耐以前. 好耐以前, something like 好耐以前. Let's see. In short-term memory, short-term we call it 最近啱啱發生嘅事. 最近啱啱發生嘅事, we call it short term. Some people think that being forgetful is not as harmful, but the reality is that it can be quite dangerous. In some cases, the elderly, if very severe case, I have to highlight it's only for severe case, they forget whether they have eaten or not. Either they overeat, okay, or they don't eat because they think that they have eaten. Eating, we call it 食飯. Forget, we say 唔記得. So everything we add 唔記得食飯. Drinking water, they also feel not thirsty, so they forget whether they drink water or not. They drinking water, 飲水. If they forget to drink water, it will lead to a situation called dehydration. Severe case, it can be fatal. Dehydration, quite 脫水. So when you look at the elderly, whether they have dehydration, you can look at their skin. If the skin is very dry, then you know that they may have dementia. Then remember to rehydrate them, ask them to drink water. And sometimes they have a lot of comorbidities such as hypertension, heart disease. Then if they forget whether they have taken medication or not, also can be serious. Taking medication, you say 食藥, 食藥. Another home safety issue, if they do cooking at home, they may forget to turning off the fire during cooking. Turn off the fire during cooking, we call it 廚房熄火,廚房熄火. Another major symptom is that they also have the part that control their emotion has degeneration. So that's why it is difficult to control their mood. So we call it mood swing. Mood swing. Sometimes they can be very happy or sometimes they can be very angry. So officially we say 情緒波動,情緒波動. A mood swing. In layman term, we may call it 脾氣古怪,脾氣古怪. Depends on the luck. Some can be very angry most of the time. I do see few cases. They feel very happy, very easygoing because they forget the part of the anger. So, but not too many cases are so lucky, I have to say. If you suspect your elderly uncles, auntie, they may have dementia, you need to seek consultation from a doctor. To further confirm the diagnosis, you need a specialist. This specialist is geriatric doctor. Geriatric doctor, 老人科醫生。老人科醫生. We have a very specialties, very specific for all these degenerative disease. They are geriatric doctors. For management, no treatment is better than prevention. To prevent dementia, if possible, just make their retired life to be more active. Active lifestyle is more important. This may not be very precise translation, but in Cantonese we say 充實生活. 充實生活. Make sure the schedule is filled up every day for exercise, for social activities they like, so their brain can keep functioning. We exercise their brain. It is very important. Every day has 4 to 6 hours social activities to maintain the not only cognitively healthy, but also physically healthy. And in some cases, for home safety problem, some people will install the CCTV in the common room and the kitchen. Make sure they don't have any home accident falling down or forget to turning off the fire. CCTV, we call it 閉路電視,閉路電視. Of course, we say CCTV here actually is also referred to nowadays. We use webcam. Webcam is more common, then you can see through the phone. Unfortunately, this condition is not curable, but with proper treatment, it can significantly slow down the deterioration, which is also very important. One of the major treatments is cognitive behavioral therapy conducted by social worker, occupational therapy, or clinical psychologist or counselor. Cognitive behavioral therapy we call it 認知行為治療. 認知行為治療. It's a very inclusive term, just using diary, using instructions or scheduling, lots of different intervention to make sure they can maintain their life and independence as much as possible. But sometimes some cases are more severe. They need some people to take care of them. There are two kinds of care for them. Daycare center is kind of accommodation. You send them to the center for exercise, medication, and eating in daytime. Then in the nighttime, pick them back to home. We call it daycare center. Daycare center, we call it in Cantonese is 日間護理中心. 日間護理中心。And then the other one is for very, very severe cases, or there are no carer at home can take care of them at night. So we will say the elderly will stay at the residential care. So they have all the things, bathing, sleeping, all set of care by the staff there. This kind of residential care in Cantonese we call it 住宿照顧. Because of high dependency of this care, and then for them may not be very favorable, but sometimes have to. That's why in the old time there is a term to describe called 住老人院. It is definitely a very last step to do so. Hopefully we can avoid that. Take caring of patients with dementia definitely is a lot of work to do, especially they are our family. We want to give the best to them. Sometimes it makes the care very stressful, but nowadays we try to put more resources and more education to make sure they have proper care. Think about that. When we were a baby, our parents take care of us also with a lot of effort to take care of our toileting, eating, everything. When they get old, they are very well deserved to have the same care to them to make sure they have very happy and healthy life in the late stage of life. I don't know how to translate this term in English. In Cantonese we call it 安享晚年. It means to ensure the elderly can have very fruitful and joyful life in the late stage of life, and I wish everyone to have it. Okay, this is the end of this session. Thank you for attending.